Hello everyone, welcome back to TimesXP. I'm Dr. Isha Soni, the co-founder and head for Lexicon Rainbow Therapy and Child Development Center Pune. Today, we are going to talk about who diagnoses autism and what are the treatments available. So, as soon as the parents notice any form of delay, the first person they rush to is a pediatrician. The pediatrician, if suspects autism, the child is further referred to a developmental specialist or a developmental pediatrician. This pediatrician would then observe the child on certain clinical observations, like if the child is responding to name, if the child is pointing, if the child is paying joint attention, does the child have any form of repetitive play or behavior or restricted interest, or is there any form of speech delay that the child is showing. For further validation of the diagnosis, the child may be referred to a developmental psychologist who then administers a few tests which are standardized and evidence-based. The ADOS, also known as the Autism Diagnostic Observation Schedule, is the gold standard for diagnosing autism. This is a test in which the person certified in administering ADOS directly interacts with the child and observes on certain clinical parameters. The other test is the ADIR, which is a more feedback-based from parents and is mapped accordingly. The other tests that a psychologist may administer are ISA, MCHAT, or the CARS. Once the child is diagnosed or is put at risk for mild, moderate, or severe autism, early intervention is recommended. Early intervention is very, very crucial in your child's development because by early intervention, new pathways can be made in the child's brain depending on the neuroplasticity. So, neuroplasticity is the ability of the brain to constantly mold itself and make new pathways. So, all the therapies are based on this. A child may be referred to occupational therapy, speech therapy, ABA therapy, and special education as per the child's requirement. Now, autism being a spectrum disorder, it affects every child differently, and the domain that is affected in every child, social, speech, motor skills, or sensory issues may be different. The occupational therapist will work on the motor skills and sensory issues of the child. The speech and language therapist will help in the communication and expressive language development of the child. A speech therapist who is also trained in oral and feeding therapy, oral placement and feeding therapy, will help the child to accept and eat food of variety and different textures. It also helps and gives exercise to the muscles that are involved in talking. An ABA therapist will primarily work on behaviors like spitting, hitting, head banging. By using the behavior modification technique, more desirable behaviors are encouraged by giving positive reinforcement. All these therapies and treatments will only be successful if the parent follows a home program. Thank you so much.